So, do you watch any medical shows and shake your head and go, "That's not right"?
Yeah, I signed off medical shows years ago because
Yeah, I feel like
you know
some people in the medical profession, like you are, like, you'll watch it and you'll be like, "Yeah, that's not right," or you just cut it off and like, "Yeah, I'm not watching that."
Or it's like, that's my life. That's like my wife, who's an occupational therapist. She doesn't like watching medical shows because she's like,
No.
that's my life. If I'm going to watch something for entertainment, I'm not going to watch my life. Right.
Well, like my sister-in-law, she's a nurse. She's a special kind of nurse. Although she's a midwife, so she can
Nice.
she lived with us for about 9 months while she was up here getting her midwife certification. And had to deliver so many babies before graduation. Right. And she watches Grey's Anatomy. But she does sit there and critique everything that the nurses do and the doctors do. And it's like, this is scripted. You know that? She goes, I know, but it's just funny to me.
Well, and it's probably she's doing the same thing in the real live nursing room. She's criticizing everything that's going on. So
she absolutely did. My brother actually got into a nasty wreck. And I was in the room like, okay, what do I need to do? What do I need to grab? And she's sitting there and she's criticizing these nurses going, you're not supposed, that's a no-no. She's not supposed to do it that way. Yeah. And she was only like in her first 2 years of nursing. And so like the rules were like engraved, and that's what you don't move into that.
So just because she's watching the TV and saying, don't do it that way, doesn't mean they don't do it that way.
Well, no, she's critiquing, I guess, the order in which they do things.
Right.
That is not what it's not actually how it's supposed to be. It's all the stuff that's made up for like drama, or to make that person look busy in the background.
Right. So let me tell you guys something that you can keep your eye out for. This is the little times I've watched, this really bothers me. So you'll have a patient, the family comes in and they're like in a coma. And they have a breathing tube down their throat. They have the tube
in their mouth, or yes.
Yeah. I want you to notice how the tube is sticking out this far, and then the ventilator connects to it, right?
Right.
That tube should be all the way down their throat.
Right.
Yeah.
Right.
And so the connectors are right here, not over here.
So rather than cutting it short to video it, they just left it the same size and just left it further out, so it wasn't actually down there.
Right. Cut it short. If you're going to fake it, at least make it look right.
Right.
So just cut it short, put it in their mouth, and put the connector here, and not have the endotracheal tube that's supposed to be down your throat, have it hanging out the side of their mouth.